Hello everybody. For the second part, today we are going to start with the skeleton system. Skeleton system includes your bones and cartilages, which are the main supporting system and the framework of the body. Number one, bones. Bones is always used with the os or osteon word. Prefix is always ost or osteon. When we compare with the terms osteology, ossification, osteomyelitis, osteomalacia, osteoma, osteotomy, etc. And there is a number of the things, whatever is concerned with osteo, that means the thing is concerned with the bones. Bone is 1/3 of the connective tissue, and rest 2/3 part is impregnated with the calcium salts. Calcium salts like calcium phosphate, calcium carbonate, and other salts. These calcium parts make it hard and rigid, due to which it can afford resistance to the comprehensive forces. While organic connective tissue, that is the collagen fibers, makes it tough and resilient, which can afford resistance and tensile forces. So, despite of its hardness and high calcium content, bone is very much a living tissue because it has very high vascular content and constant turnover of the calcium. It shows characteristic pattern of the growth, and it is subjected to the diseases and heals after the fracture. It has greatest regenerative power after the blood. Classification of the bones. Now, first of all, we'll be classifying bones according to the shape, wherein we have long bones, short bones, flat bones, irregular bones, pneumatic bones, sesamoid bones, or you can say accessory bones, and heterotropic bones. Number one, we'll be dealing with the long bones, where each long bone has a long shaft, that is the diaphysis, and two expanded ends, that we known as epiphysis, which are smooth and articular. The shaft has typically three surfaces that will be separated by the three borders. Okay, the central will be medullary cavity and the nutrient foramen directed away from the growing end. For example, typical long bones are humerus, radius, ulna, femur, tibia, fibula. There are some miniature long bones also, wherein we have only one epiphysis, that are metacarpals, metatarsals, and phalanges. There are some modified long bones that have no medullar cavity, like the clavicle bone. Then the short bones. The shape is usually cuboid, cuneiform, or trapezoid or scapoid. For example, tarsal or carpal bones. Then the flat bones that resemble the shallow plates and forms the boundary of the certain bone cavity, like you can say bone of the wallet of the skull, ribs, sternum, scapula. These are like the shallow plates. Then the irregular bones are like vertebra, hip, and the bones in the base of the skull. We cannot define its shape. Then the pneumatic bones are irregular bones that contain large air space lined by the epithelium layer. For example, maxilla is there, sphenoid is there, ethmoid is there. The skull make it light in weight and help in resonance of the voice, and acts like air conditioner for the chambers for inspired air. Then we have sesamoid bones. These are the bony nodules found embedded in the tendons or the joint capsules. They have no periosteum or ossifying after birth. They are related to the articular or non-articular bony surfaces. The surface of the content are covered with the hyaline cartilage and lubricated by the bursa, or you can say the synovial membrane. For example, this is patella, the pisiform bone, and fibula. The functions of the sesamoid bones are to resist the pressure, to minimize the friction, and to alter the direction of the pull of the muscles, so that the local circulation is maintained. We have accessory bones, which are also known as supranumerary bones, which are not always present. These may occur in ununited epiphyses developed in from the extra centers of the ossification, like sutural bones are there, or you can say lateral tubercle of the talus is there. and tuberosity of the fifth metatarsal is there. In the medical legal practices, these accessory bones may be mistaken for the fractures. However, these are often bilateral and have a smooth surfaces without any callus. Then we have the heterotropic bones. Sometimes bone is developed in soft tissue, like horse riders develop bones in the adductor muscles, that is also known as the rider's bone. According to the developmental classification, bones can be divided into three types. Number one is membrane, or you can say dermal bones, which ossify in the membrane, and they are derived from the mesenchymal condensations, like the bones of the wallet of the skulls and the facial bone. Then the cartilaginous bones ossify in the cartilage and are derived from the cartilaginous model, like the bones of the limbs, vertebral column, or the thoracic cage. Then we have the membranocartilaginous bone ossifying partially in the membrane and partially in the cartilage, that is the clavicle, mandible, occipital, temporal, and sphenoid. Structural classification, according to it, the bone can be divided into macroscopic look or the microscopic look. Macroscopically, we divide it into the two types, that is the condensed bone and the callus or the spongy bone. Condensed bone is dense in the structure and is extremely porous. It is best developed in the cortex of the long bones. It is adapted to the bending and twisting forces. Callus or spongy or trabecular bone is open in structure and is made up of the meshwork of the trabeculae, between which marrow containing spaces are present. These trabecular are of three types. Number one is meshwork of the rods and plates, and then the meshwork of the plates only. Microscopically, we divide the bones into five types. Lamellar bone, which are mature human bones and are composed of the thin plates of the bony tissue called lamellae. These are arranged in the piles in the callus bone, but in concentric cylindricals in compact bones. Woven bone, which are seen in the fetal bone, fracture repair, or in the cancer of the bone. Then we have the fibrous bone. Fibrous bone is found in the young fetal bones, which are more common to the reptiles or amphibian. Then we have dentine, and then we have cement, which occur in the teeth.